We just note that some of the governors have been here in town for a couple of days. They're anxious to get back to their home states. We know that the airport is only minutes away, but because of that, we're going to be very, can be right on in terms of the clock. So expect a fast gavel for all of our members. This month marks the one-year anniversary of the President signing into law a pair of controversial health care bills that are transforming the way Americans receive and pay for health care. We convene this hearing today to hear from the governors about what impact the health care law has had on their states thus far and what they believe to be the toughest challenge that they face in implementing the President's health care reform package over the coming years. Medicaid currently covers nearly 54 million Americans, and the administration's chief health actuary has estimated that the Medicaid expansions included in the law could increase the nation's Medicaid rolls by at least 20 million beginning in 2014. While the President's health care reform package altered the relationship that the federal government has had with the states by requiring that states drastically expand their Medicaid populations, governors are also deeply concerned about the new unfunded mandates in the law and their impact on current state budgets. The CBO estimates that these mandates and expansions will cost the states at least $60 billion, but the states themselves estimate the cost to be nearly twice as much. Today, I join members of the Senate Finance Committee to release the first comprehensive analysis of what the states themselves expect to spend as a result of the health care law, and the results are sobering. Even using conservative estimates, the states expect to face an additional $118 billion in costs through 2023 as a result of the law's mandate. Today's governors cannot afford to continue offering the same benefits in the same way to their existing Medicaid populations. However, the health care law puts them between a rock and a hard place. They cannot make eligibility changes in their options programs because the health care law freezes their current programs in place for years. This hearing will be an opportunity to hear from three of the nation's most thoughtful governors. Although as governors you are following very different roadmaps concerning health care reform, I believe that you can all agree that state innovation and flexibility are key. And I yield now 1 minute to Mr. Barton.